Hi everybody, we're going to talk about our non-transport protocol here for Liberty Township, which coincides with the guidelines that the Southwest Ohio Protocol put out. We're going to go through this piece by piece, as well as a home care for COVID patients if we choose not to transport. So getting started, one of the most important things to note here that today is the 26th of March, 2020, and that COVID-19 is an evolving situation. It's obviously a pandemic that we are dealing with. Southwest Ohio Protocol, as well as Liberty Township, is dealing with this the best that we can, and we are evolving with the situation. So this may mean that this may change. So as trainings get put out, try to keep up with them, listen to them, take the tests that are available, fill out your sign-ins, make sure you're getting your EMS credit and that you know what's going on, and most importantly, how to best take care of our residents and people coming through our community. So start right here in the top left-hand corner. Communication Center indicates that this person is a high risk, or we have a high suspicion this person is suffering from COVID-19. We're starting here. So if the answer is no, it's very easy for us. We're going to use normal protocol for the patient. Our presentation complaints, we're going to treat their signs and symptoms. We're going to do a normal differential diagnosis. We're going to treat them appropriately. And may or may not transport them just based on their decision. Use your normal thought process as far as everything else goes with that. If our answer is yes, we're going to scale down the left side of this sheet, the left side of this protocol. In accordance with all the SOGs and policies that have come out previous to this, we need to keep doing a good job of donning our appropriate PPE, eye shields, N95 masks. If it calls for it, stat packs. Make sure you're following all those procedures as they have been previously published and put out by command staff. Still use the SCOUT protocol. So SCOUT protocol, this is going to be big for everyone to understand, whoever's acting as our scouts. Get in there, we're going to perform our assessment, just like we've published, just like we've put out. What are we looking for? What is our inclusion criteria for a non-transport decision? Their age, less than 50 years old. They have one or more of the viral symptoms present. Fever, cough, nasal and chest congestion, sore throat, body aches. Their vital signs are meeting any of these parameters here. They're between 8 and 20 breaths per minute. Their pulse ox is greater than 94. Heart rate's less than 100, systolic's greater than 100, and then they linked in the pediatric normal vital signs over here for us, directly out of our protocol. As you've probably already noticed as I'm talking, all those are normal vital signs. Okay? That's good, because remember, we're talking about a non-transport disposition here. So we recognize that yes, they are suffering from some sort of viral disease probably, or they know they have COVID-19, but they're managing it well, and they're able to manage it well. These are our patients that we're going to consider for this protocol. So, do they meet all the above criteria? No. If we answer no, we scroll back up. Use normal protocol, patient, presentation, we treat them. Treat their signs and symptoms, differentiating diagnose. Do they have underlying comorbidities that we need to concern ourselves with? Get our 12 leads. Make sure we're doing a good job of monitoring their capnography. Treat them appropriately. If it's yes, we need to consider something else. Okay? What exclusion criteria could they also be having that is going to dictate that we need to transport this person? Chest pain other than with the mild cough, shortness of breath at rest, syncope, altered mental status, history of diabetes, comorbidities, and then any concern by you, the healthcare professional that's on the scene, that is not safe not to transport this patient. All this stuff right here, these are our provider instincts, right? Something just doesn't look right. Something's not normal. Altered mental status is always a big one that jumps out at us as far as when we're treating our patients on a normal basis. If this person's suffering from COVID-19, that should not change. If they have an altered mental status, despite what their vital signs say, something else might be going on. Okay? The ones who are going to suffer from the most are the ones that lie in this category right here with comorbidities, an extensive medical history. We need to be looking out for our patients. So these, if they meet this exclusion criteria, it changes a little bit, right? Because we're going to come over here, do any of the exclusion criteria apply? If the answer is yes, we scroll back to the top, and we need to transport this patient and treat them appropriately, just like we would normally with any other patient. If we scroll through the entire left side, and we have answered no, we come to this section right here, our non-transport disposition. So this is our decision that we are not going to take this patient because we believe with a high suspicion, or we know for sure they have COVID-19, and they are able to manage themselves appropriately at home. So this must be made and documented in our PCR by the highest certified personnel on the scene. That needs to be a paramedic. We have a paramedic on all of our units. There really shouldn't be any reason that it's not one of our paramedics. We need to have a patient or guardian, and the capacity and consent to non-transport. So they need to understand, basically be able to have the understanding of why we are not transporting them. Explain it to them. Don't just tell them that we're not taking them because they have COVID-19 and they're not serious. They obviously called 911 for a reason. They're probably scared, rightfully so. This is a pandemic. So we need to talk them through this and talk them how to take care of themselves. We're going to get into that with the take-home care sheet in just a minute. Home care must be suitable for the patient. So that means that if they need caregivers, they need to be able to be there. They need to be able to quarantine themselves in a separate room and then have access to everything that they need: food, water, blankets, the ability to wash their hands and really separate themselves. And then we want to give the COVID-19 home care packet to the patient. That way they can review it, and we need to review it with them. Sort of talking about what we just briefly discussed there at the top. If any question exists, call medical control and discuss everything that you're considering here. Okay? If there's anything that's not covered here, it's always a great idea to call our medical control people and get them involved. They're going to be a great resource for us throughout this whole process, and especially if we get to this point where we are overwhelming our ERs and our ICUs and we need the ability to not transport people. Let's not be afraid to get our docs involved. They see a lot more than we do, and they can probably shed a little bit of light to our patients, through a phone call rather than us trying to explain this to them over a piece of paper. So here's the home health care sheet that we're talking about. These are instructions for our patients to take care of themselves at home if we've deemed through the previous page that we're following the protocol. We are not going to transport them. So we're not transporting them. Pretty straightforward. We leave this with them and then we need to go over it. This is all stuff that we've been seeing over the last couple of weeks as things have developed. They need to get plenty of rest and drink plenty of fluids. That's a big one. Drink lots of water. It's good. Control their fever. Stop spreading germs. All the same stuff you've seen. So this sheet not only does it cover what to do while you're at home taking care of yourself, but it also does cover a little bit about what to do if what you're doing at home is no longer working. Because just because we did the non-transport protocol one time on one patient, it's just like a refusal. It's just for that one moment in time. They can call 911 again, and this is a guide for them to use when they should call 911 or seek medical attention at an ER on their own from this point forward. And talk them through this and really describe what's going to happen and how they could start to feel. Are they going to start getting confused? That altered mental status, that should be a bad sign, not just for us, but for them and family members or their caregivers. Can't keep fluids down. They're getting dehydrated. Most people have been dehydrated before. Talk them through it. Difficulty breathing. If they can't talk without saying, taking a breath in between one word, that's an issue. And describe it to them. Then they've probably reached the point where they have reached our serious patient that really needs the assistance from our ERs or maybe our ICUs. and we can talk them, and then they can call 911. We can take them wherever we need to take them. The sheet also runs through how to protect others. This is a lot of the stuff that we have implemented at the firehouse as far as disinfection, not intermingling with our crews. It really doesn't change for people, and probably what we're doing on our off days. So stay home or don't go to work. 24 hours is, after your systems have gone away without using fever-reducing medicines, because they may not know they have COVID. They can give that to their family and friends. If you start feeling sick, you may not know what you have, but you need to stay away from people who are sick or who have COVID. Wear a mask if possible. They're probably not going to have access to an N95, and we should not be giving ours out to them. But we can give them a surgical mask and let them cough into that. They need to be coughing into something other than the open air. We don't want this to spread as much as possible, and we certainly don't want people to spread it within their own homes. Bedrooms, when they're able to quarantine themselves, their own bedroom is great. Their own area of the house is great, but they also need to have access, preferably, to their own restroom, a place where they can not have to worry about spreading everything to other people who are coming in and washing their hands or using the restroom or taking a shower. Explain to them that it truly is an isolation, not just going into your bedroom for a couple hours and every time you need something to drink, you come out into the kitchen. Really, they should be isolating themselves in their home, and the other people living in that home should also be isolating all the places that person travels. We covered coughing and sneezing. It's important. However they decide to do it, if you want to help them through that, that's great. Hands, and then keeping everything clean, high-touch surface areas, all those need to be disinfected. This is no different than what we're doing here at the firehouse. So over the next couple days, get this done. Review this video. We're going to attach both of these flyers here, the protocol and the home care instructions, with this video. You need to watch the video, and then you're going to need to take the quiz to ensure that you have not only listened to but retained the information that's been throughout this. You're going to see more of these come out. This is definitely not the last one. We have the ability to now implement information and training via video and capturing screens. So look for these. Don't ignore them. Make sure you get these done and get your training rosters filled out. And make sure you fill out an evaluation, an EMS topic evaluation. Fill out the quiz, complete it, and get it to your officer, and they will be forwarding it to headquarters for Lieutenant Oaks. Thank you.